Lung cancer is the most common cause of cancer death in the United States, and November is Lung Cancer Awareness Month. So we wanted to talk more about this, and joining me now is Dr. Surit Sharma, a pulmonologist from Skyridge Medical Center. And Dr. Sharma, tell us first about lung cancer and what it all entails.
So lung cancer, as you mentioned, continues to be the deadliest form of cancer. For example, in 2020, there were probably 230,000 individuals diagnosed and over 130,000 individuals who died from that condition. Even with all the advancements we've made in oncology, our best bet of curing someone is early diagnosis. And that's why I'd like to promote lung cancer screening. So we've discovered that for high-risk patients, if you screen them with CAT scans, we're able to pick up these cancers early. And there's a clear benefit of 16 to 20% mortality. So if we catch these cancers early, we're able to resect them. That's our best chance of cure.
Absolutely. We know that early detection is always just key. You mentioned how kind of prevalent it is these days. What are the causes or risk factors of this type of cancer that people should be aware of?
So still by far, the biggest risk factor is smoking. And so what we do is we analyze based on a calculation we refer to as pack years on the amount of cigarette smoke inhalation. So for example, if someone smokes 1 pack of cigarettes per day per year, that's considered a pack year. If you smoke 2 packs, that's considered 2 pack years in that same year. So individuals that have a total of 20 pack years, we put them into this higher risk category. Other associated factors include age. Unfortunately, just as we get older, we have a higher risk of cancer in general. There are some environmental factors. For example, asbestos is a significant factor. We always ask whether someone has had asbestos exposure. Other conditions where it's a little unclear, but we still consider a risk factor would be radon, for example. A family history is very important to elucidate as well.
Great, and I know there's been a lot of research done over the years, and you kind of mentioned some advancements in detection and treatment. Tell us a little bit about those advancements that we've seen.
So what we often do is if we characterize someone as a high-risk individual, so again, if they've had 20 pack years smoking, they're an active smoker, or they quit less than 15 years ago, and the age criteria now is between the ages of 50 and 80. We start them on a lung cancer screening protocol, much like mammograms for breast cancer or colonoscopy for colon cancer. If we find a small nodule, our technology has improved to the point that we are able to biopsy these nodules at an earlier stage. And so that's allowed us to intervene sooner rather than later. There are many individuals, and I don't want people to panic, that we do find lung nodules, and the vast majority, even in high-risk patients, end up being benign nodules. Because it is risky at times to biopsy these nodules in the lungs, often we will follow these individuals with serial CAT scans for a few years, and if the nodule is not changed, then we're very confident that it's benign.
Very interesting. Great. Is there anything else that you want people to know about that we haven't talked about related to lung cancer?
Again, I just want to emphasize that smoking cessation is very important. We try to intervene, hopefully at a young age. Our teenagers, high school kids, you'll often see, and over time, it definitely takes its toll. And if you have not heard of lung cancer screening and you are in a higher risk category, please reach out to your physician. We feel it's very important, again, to catch these cancers early, and there's a good chance of cure if we're able to do that.
Is there a certain age that people should start thinking about those screenings?
Again, right now, we consider 50 to be the lower cutoff. But again, if you have a heavy smoking history, talk to your doctor, because there are nuances. And if you have other risk factors, maybe we analyze things a little bit sooner than the standard guidelines.
Well, thank you so much, Dr. Sharma, for all this important information. We really appreciate it.
Happy to do so. Thank you.
Great. And for more information on Lung Cancer Awareness Month, you can head over to cbsdenver.com.